As a psychiatric mental health nurse practitioner, not that many people know we exist. Not that many people know exactly what we do on a daily basis. So in this video, I'm going to be going over 10 facts about psychiatric mental health nurse practitioners so you have a better idea of what we do. So stay tuned. Welcome back, Psych Dude family. It's good seeing each and every one of you guys today. If you are new to this channel, let me formally introduce myself. I'm the Psych Dude. I'm a board certified psychiatric mental health nurse practitioner, and in this channel I go over several different subjects to educate the public about mental health, ways to improve your lifestyle, topics related to nursing, nurse practitioners, and psychiatric mental health nurse practitioners. If you are interested in any of these topics, feel free to subscribe. Make sure you give this video a big thumbs up to help me out, and follow me on Instagram at THEPSYCHDUDE. And make sure you say hi because I love talking to you guys. So, you probably clicked this video because you're interested in finding out what a psychiatric mental health nurse practitioner is, or just interesting facts about us. And a lot of the times people don't necessarily understand what we do, what our qualifications are, and things like this. It's going to be a very broad video that kind of just gives you subjects, gives you topics just about us. It's not going to, a lot of these things you may know already, a lot of these things you might not know already, but I definitely just wanted to cover them and make sure that you know, so going forward, or whoever you speak to going forward, if you could actually explain what we do. So these are 10 facts about psychiatric mental health nurse practitioners, so let's get started. So the very first fact on my list about psychiatric mental health nurse practitioners is the fact that psychiatric mental health nurse practitioners need a minimum of a master's degree. So a lot of the times within this degree, a lot of people either go the master's route or they go the DNP route. There's a lot of schools now that are popping up for the DNP route that give you the DNP along with a certification to become a psychiatric mental health nurse practitioner. Or you can go the other route where you get your MSN with a certification in psychiatric mental health nurse practitioner. So we have to have a minimum, but it seems like a lot of schools are heading towards the DNP route. So if you are looking at becoming a psychiatric mental health nurse practitioner, you need to know that you at least have to have your master's in order to practice. So the second fact about psychiatric mental health nurse practitioners is the fact that currently psychiatric nurse practitioners are trained across the lifespan. And it wasn't always like this. Before, you were trained just for the adults, but now we're trained across the lifespan. And if you had your just adult psych nurse practitioner, psychiatric nurse practitioner certification, you actually have to do the child adolescent side and be able to go through that section in order for you to be trained across the lifespan. But right now, during all the programs, we are trained across the lifespan, so we can see children, we can see adolescents, we can see adults, and geriatrics. So that's something pretty interesting about the training nowadays compared to before. So the third fact on my list about psychiatric mental health nurse practitioner, it kind of goes hand in hand with the second one, but there are some people that are just board certified to see only adults and geriatric patients, but it does kind of blur within that range. So to stay on the safe side, some people do say they just want to see 16-year-olds and above, and technically they're allowed to per the board, but I would definitely double check with your board of registered nursing to see if that's correct. But like I said, nowadays they're training everyone to see patients across the lifespan, but there are still some current psychiatric mental health nurse practitioners that are not allowed to do that, and they can only see about 14 or 16 and above. So the fourth fact on my list about psychiatric mental health nurse practitioners is that we assess, diagnose, and treat, pretty similar to how PAs do and pretty similar to how MDs do. So we're able to do that. We're able to assess them. We're able to diagnose, and we're able to treat, and yes, we're able to prescribe. Some states are independent, so they don't need that supervision, but other states we do need that supervision, or we need the collaboration. And some states they need a doctor in order for them to prescribe certain controlled medications, and other states you don't need that. So it's definitely state by state, but for the most part what we do is we diagnose, we assess, and we evaluate, treat, and we do all of those things pretty similar to what PAs and physicians do. So the fifth fact on my list about psychiatric mental health nurse practitioners is yes, we do prescribe medications. So like I mentioned in the previous one, we do prescribe medications. A lot of people don't necessarily realize that as psychiatric mental health nurse practitioners that we're allowed to prescribe medications. Yes, we still get that all the time when a patient walks in. Oh, I'm here to see my psychiatrist, not you, because you can't prescribe. But in fact, we can. And they kind of seem shocked, but at the same time, they're happy because they get to see us. So we do prescribe medications, and like I said previously, that each state is kind of different when it comes to controlled substances. California, we're able to prescribe controlled substances without just the direct supervision of the physician, but we do need to have a collaborative psychiatrist in order for us to be able to do anything in pretty much in the state of California. But that's different when it comes to other states like Arizona, Nevada, Washington, Maryland. You're allowed to prescribe all of these medications without supervision. I know Nevada might have some restrictions like within the first 2 years or something like that, but after that they can practice independently, and they're able to prescribe controlled substances and go about that. So yeah, each state is different. Depending on your state, I would definitely double check what your restrictions or what you can do in order for you to be able to understand what you can do. So definitely look that up. So the sixth fact on my list about psychiatric mental health nurse practitioners is the fact that many psychiatric mental health nurse practitioners actually work in the primary care setting, but we're not limited to that. We can work in the urgent care setting, we can work in a crisis center, we can work in inpatient, we can work doing rounds at boarding cares or SNFs or any of these specialty places, but primarily a lot of us work in the primary care setting. So that includes outpatient psychiatric offices, FQHCs, or in a community mental health centers, things like that. We're able to work in there. So we're kind of not limited, but at the same time, a lot of the opportunities are in the outpatient setting, and primary care setting, because we do provide those services. The seventh fact on my list about psychiatric mental health nurse practitioners is that many MSN psychiatric mental health nurse practitioner programs are actually transitioning into a DNP program. So when I went to school during my MSN, well, I got my postmasters, but it's pretty much the same thing, that I actually had to attend a 5-semester program. So during this 2.5 years, I had to take all of these courses, but now they're actually transitioning, so they shorten the program in order for them to transition into a DNP program. So instead of 2.5 years, they shorten it to 2 years, and then after that, they're gonna implement the DNP program where it's only gonna be 3 years. And a lot of places are starting to do this. A lot of schools are not even if they do take students, they're actually giving them the option of whether or not they want to go to the DNP program. And I think it's pretty cool. I think it's going to save a lot of time, but at the same time, for the people that don't really care about the DNP program, it's kind of not going to benefit them. But at the same time, it's going to kind of strengthen us as a group, especially as nurse practitioners start to move in that direction, because CRNA is already moving in that direction where they do need that DNP by 2022. For us, there's so many different rumors. Yes, 2015, and then there's 2022, now it's 2025, and so forth and so forth. But if more and more schools actually go towards this route, then we're going to be able to actually instill it where everyone needs to be having their DNP when they graduate as a nurse practitioners. Of course, all the existing NPs are probably just gonna be grandfathered in and go from there. But an interesting fact is the fact that they are transitioning from a lot of these MSN based programs into the DNP program. So that's definitely something you have to look out for, and it's a positive, especially if you are going to choose what school you're going to go to. Might as well just choose that DNP program route and get it over with, instead of if you want to change your mind and go back again to school, because everyone hates going back to school, especially if they've been practicing for so long already. So the 8th fact on my list about psychiatric mental health nurse practitioners is that in 20 plus states, 20 or more states, Psych NPs are able to practice independently. Yes, in majority of these states, you can't practice independently right away. There might be some restrictions, some change, some have, you need like 2,000 hours before you can practice independently, or you might need supervision for a certain amount of years before you practice independently. But what's crazy is there are 20 or more states, with more being approved by the minute, that you're allowed to practice independently, meaning you don't need a physician in order for you to collaborate with, or you don't need a supervising physician to look over your notes. You can practice the way you want and how you want to without any supervision, which is a huge win for nurse practitioners. I know they're trying to transition this for PAs in certain states, which I truly hope they do, but they might kind of have to switch their name from a PA to something else, because physician assistant, just the assistant part doesn't justify what they do as a whole. I don't know what they're gonna switch it to, but I think it will be pretty cool if they do switch it, because once they're able to practice independently alongside all of us, then there's gonna be way more access to care, especially within mental health is what we need. I think it's gonna be amazing, and we just need to kind of transition to that. I don't think it's ever going to happen in California anytime soon. Yes, there's certain bills put in place, hopefully, that can allow this, but it's something ridiculous, like you need to be practicing for like 5 or 6 years in order for you to do it. And if you want to open your own practice, you need additional 5-year training in order for you to do that. So it's like a 10-year deal if you want to open your own practice. Pretty crazy, but for the most part, yeah, I'll just stick to just having a collaborative psychiatrist for now. So the 9th fact on my list about psychiatric mental health nurse practitioners is something you guys will like, that majority of us make 6 figures. So as a nurse, some of us can make 6 figures, but at the same time, a lot of us average around 60, 70, 80,000, and if you work for Kaiser in California, then you're already making 6 figures. But for the most part, we do average 6 figures kind of nationwide. Yes, there are some states here and there where some people won't get 6 figures, but for the most part, we do get 6 figures. So if that's something you want and something that you care about, because let's be real, like, you have to get paid for what you do, and we do a lot, and we have a lot on our plate to do, and we deserve it. But if that's something you're looking for, yes, psychiatric mental health nurse practitioners can make this amount of money, and it's great that we have the opportunity to, and it's just going to continue to get better and better, and hopefully we can continue to provide the best quality care while still getting money in our pocket to help everyone. The last fact on my list about psychiatric mental health nurse practitioners is Psych NPs are booming right now. So I definitely and highly suggest that if you want to become a psychiatric mental health nurse practitioner, get your experience, become an RN obviously, get your experience, and then go into psych, because it's booming right now and it's getting extremely popular, and hopefully it doesn't get way too oversaturated. Hopefully we don't get too many programs that are just, or diploma mills that are just pushing out psychiatric nurse practitioners, because it definitely is going to bring down the quality of our providers. But for the most part, it is a booming career. So if it's something that you truly love, something that you truly want to get into, then I definitely suggest you try to get into it sooner rather than later. There's a lot of people that constantly ask me, oh, should I wait how many so-and-so years get experience? Yes, that's great, but at the same time, you don't want to miss out on becoming a psychiatric nurse practitioner, because more and more as the years pass, more and more psychiatric nurse practitioners are going to be coming out because of these diploma mills, and it's going to be a lot harder for us to find a job. And when we're talking about those 6 figures salary, people getting paid a lot, it's going to actually decrease. But at the same time, we got into this field and got into this career because we wanted to help and we want to be able to provide care and kind of increase the access to care. So in that regards, I think the best route is for all of us to come together and then make sure we come out with quality nurse practitioners, quality providers, in order for us to give and provide the access to care. And why not join our group and this booming state and continuing to do the best that we can in becoming a psychiatric mental health nurse practitioner. Kind of a mouthful, but well guys, I hope you guys truly enjoyed this video. I hope you guys liked all of these facts about psychiatric mental health nurse practitioners. A lot of them are pretty common sense, but a lot of them people don't necessarily understand or know, especially from outside looking in. If you're already in the mental health field, then you kind of already seen a lot of us. But if you're just a regular patient or a regular person that doesn't or is still looking into what they can be, then you're going to understand that these facts are definitely helpful for you. So a lot of these things, just definitely take it all into consideration. Make sure you do your own research, because at the end of the day, these facts may change. A lot of these things that I mentioned now may change, so who knows what's going to happen. So make sure you always do your due diligence in doing your own research. As always guys, have a wonderful day. Until next time, bye.